It's a Wellness Wednesday on SVI Media, sponsored by Star Valley Health. And today I'm talking with Kyle Roniger, Director of Nursing at Star Valley Health. And Kyle, today we're going to talk about COVID and care at Star Valley Health for COVID patients. Of course, this has been an ongoing, evolving thing since day one, and it's been no different for you guys and at the nursing station. Let's talk about how this has evolved as far as what type of treatments are available, and kind of from day one to currently, how has COVID evolved as far as treatments at Star Valley Health?
Perfect. It kind of caught everybody off guard. How it started here was once we started getting people that thought that they had COVID or had symptoms of COVID, they started by calling the ER, coming into the ER to get tested and to be seen there from that point. So we started with patients coming to the ER for treatment. We started a COVID hotline that the residents of Star Valley could call to get information if they needed to come in and be tested. The next step there was to provide a COVID testing tent is what we started with, which was literally a canopy with 4 walls, which is freezing in Star Valley. So even that's evolved from that into, we've got a station set up on the west side of the clinic. That's a drive up COVID swab station. So started by going to the ER. We got those tents in place, and then you can come in and get swabbed. We have changed testing here. We were super lucky for being such a small community to get COVID testing pretty quickly. Our lab did a great job to get that set up, so we had that available to the residents of Star Valley. And then since that's evolved now, where we're seeing COVID patients in the ER and in the hospital, we do have negative pressure rooms, which are rooms that their airflow runs differently so that it's not recirculating air. And those are kind of the gold standard for COVID positive patients or people that are under investigation of having COVID. We put them in a negative pressure room that ventilates that air properly. So we have those in the ER, in our operating room area, and on the nursing floor on med-surg. And then the next evolution of that was treatments that you referred to. So we do have some different medications that we are giving. So we are set up to take COVID positive patients in the hospital. We do have not necessarily, but we've done a good job at looking at where we can place patients if they do need hospitalization locally, whether that's at Ermac or down in the Salt Lake area if they're looking for hospitalization, need some intensive care there.
Kyle, let's touch on that just a little more. There is a misperception maybe among the community that Star Valley Health is not set up to treat COVID patients, but it sounds like you're perfectly capable, but those that may need longer-term hospitalization care, they're going to other facilities, but it sounds like you've got everything in place here to take care of anyone, and regardless of COVID or no COVID.
Correct. Yeah. So we are set up. Like I said, we have those negative pressure rooms throughout the hospital. We have done our central supply department has done a great job to make sure that we have the PPE supplies that we need to keep the nurses, the CNAs, and the doctors safe while they're taking care of COVID patients. So we have all of that set up. So yeah, there's kind of a difference in the care that COVID patients get. You know, there's some patients that have mild symptoms that don't need any hospitalization. There's some patients that come in that need oxygen and some different medications. And then there's people that need to be, that need more intensive care that we can't provide at Star Valley Health. So those are ones that we look to send either, like I said, to Ermac or hospitals down in the Utah area.
Speaking with Kyle Roniger this morning, Director of Nursing at Star Valley Health, as part of our Wellness Wednesday on SVI Media. Kyle, let's talk a little more about where these treatments are provided. I think you kind of touched on it, but again, where do you provide these treatments at?
Perfect. So like we've said, yeah, we will start them in the ER. You know, if someone feels that they need to be seen, they'll come to the ER. And then we'll predict from there if they need to be shipped out somewhere, if we need to admit them to the hospital. We have added a new option a couple of weeks ago. So we have set up an outpatient infusion clinic for COVID positive patients. So there are some medications that we can give to patients that are COVID positive to help them speed up that recovery. And we've set up an area in it's our specialty clinic, which used to be the urgent care building on the west side. So we set up a room there, set up as negative pressure so that we can have patients come in. Some medications are once a day for 5 days. Some medications are a couple of hours one time. So just depending on the medication regimen that's been chosen for you, we have it set up where you can actually not be admitted to the hospital, but come back daily to get those medications, go home and, quarantine, do your thing, but you don't have to be in the hospital. And we've also set people up with oxygen if they need oxygen, and not admit them to the hospital, just have them have oxygen at home. But then we do ultimately have it set up on our med surge floor if you need a little bit more than oxygen and medication and some time to come and stay in the hospital.
That's Kyle Roniger, Director of Nursing at Star Valley Health. Kyle, thanks so much for your time. Anything we missed?
No, I think that sums it all up.
It's all part of our Wellness Wednesday, sponsored by Star Valley Health.